Hi, one of the things we do in the dental office when we do complicated procedures, in fact we even do this with simple procedures, something as simple as a teeth whitening, is we have patient consent forms. So I want to talk about that a little bit so that everybody kind of understands from a medical legal standpoint why I'm as passionate as I am about patient consent forms. Now, I've been an expert witness in countless cases, and I've been an expert witness not only at the plaintiff side, that means the patient suing the doctor, but I've also been an expert witness on the defense side, which is the insurance company that represents the doctor in a malpractice suit. And what you're going to find out is that if a patient consent form were properly done and properly communicated to the patient, there'd be a lot less problems. So what's the most important thing to a patient consent form? Well, in most offices, patient consent forms are something that is being done as a procedure either by the dental assistant or the admin to the patient. And what my challenge is for all of you is that consent form, the consent process, should be done between the doctor and the patient. And the doctor literally goes through every single paragraph of that consent form so the patient truly understands the downside. So let's talk about like the most obvious kind of thing that could happen. Say for an extraction. An extraction can result in a paresthesia, it can result in a dry socket, it can result in a loss of bone, it can result in pain, it can result in a lot of different things. If the dental assistant is doing the consent for an extraction for the patient and doesn't truly understand what each of those things means, because for the most part they don't occur all that often, then they tend to gloss over it. And if something does go wrong, and things always go wrong, but not very often, thank goodness, the patient gets mad because the patient didn't really truly understand what they were consenting to. The dental assistant was in charge of the consent, or the admin was in charge of the consent, but the doctor's the one who gets the blame. So what needs to happen is the doctor needs to go over the consent form with the patient, literally paragraph by paragraph, and to explain what these procedures mean in layman's terms. And once that occurs, and then the doctor turns to the patient and says, are there any other questions that you have? Do you truly understand everything that I'm talking about? Because I want to make sure that the 10 minutes that we've spent going over this consent form really gives you a very broad and sometimes a very specific understanding of what can go wrong with these dental procedures. And only then am I going to allow you to consent to this so that I can do this procedure for you. And what you're going to find out is the communication between the patient and the dental office, the patient and the doctor, the patient and the dental assistant, the patient and the admin becomes so much better. Because if something does go wrong along the way, the patient feels that the office is their friend. And people typically don't sue their friends because they understand that things can go wrong, and as long as the office is communicating with the patient about how they're going to resolve this issue, patients are okay with it. Patients typically sue doctors, they sue the office when they feel they've been disrespected. Now, granted, there are times when patients have truly been harmed, but what you're going to find out is most of the time when patients are suing doctors, it's because they feel they've been disrespected or taken advantage of. And of course, doesn't really happen all that often, where the patients truly have been treated poorly. But what happens in the eyes of the patient that they have, and they think that they really truly deserve to sue the doctor. So what's the take home as far as patient consent forms? Have the doctor talk to the patient and get the consent from the patient, and then have the patient sign and have the doctor sign afterwards in front of the patient. And then, and this is the really, really important part, in the patient chart, the treatment notes for that day is the doctor led the discussion and the patient consent. The doctor went through the form paragraph by paragraph. The doctor signed the consent form in front of the patient after asking, are there any more questions about the procedure that you want to take? So between the consent form and the patient notes, you've done everything that you're supposed to do to truly inform that patient, to truly educate the patient about the dental procedure. When you start doing that, all of a sudden a lot of the complaints you get from patients will go down to absolute zero. That is an amazing take-home point today. Thank you.